Generally, basic cause of acne vulgaris is still unknown, but there are several mechanisms which explain the development of acne. First is occlusion of pilosebaceous orifice. Means when the pilosebaceous orifice is clogged by the keratinous plug, then acne is produced.
Yes. This is the place where it is blocked. तो sebum का जो secretion होता है that get blocked और उसकी वजह से acne होता है. This is how you can explain to the patient. That is required practically. How you can explain, show such a figure to the patient or explain them. Yes.
Now, how the keratinous plug is obstructed by the use of the chemical substances. This is in this time. This is the world of cosmetic. Lots of people, male and female, girls and boys, are using the cosmetic in their routine life. So the cosmetic product which are oil based that may clog the keratinous plug, or maybe the sebum which containing the linolenic acid, that amount is reduced by which the acne may develop. Or the third is the retention of sebum. Retention of sebum which causes the development of microorganism in the duct, and then the vicious cycle of acne begin.
Yes. So chemical are the main culprit nowadays. So in those cases, girls are not going out without makeup. That is the trend nowadays. So in those cases, we have wonderful remedy that all of you know. कौन सी medicine है?
Bovista.
हाँ, Bovista. You can think of Bovista when कोई शादी में गया है या फिर कोई कहीं फंक्शन में गया है और मेकअप किया है या एक्सटर्नल एप्लीकेशन केमिकल यूज किए हैं, उसके बाद एक्ने बढ़ गए. इवन वैक्सिंग इज वन ऑफ द कॉज. उसमें भी एक्सटर्नली केमिकल यूज होते हैं और उसकी वजह से भी जितने लोगों को एक्ने होते हैं, इन दोस केसेस वी कैन थिंक ऑफ दिस बोविस्टा. और कई बार वैक्स के बाद वो रेड इरप्शंस भी हो जाते हैं, तो दैट इज वी कैन कंसिडर्ड एज अ बर्न ऑल्सो. वो जो वैक्स गरम यूज करते हैं, तो दैट कैन बी कंसिडर्ड एज अ बर्न. तो उसमें भी वी कैन थिंक ऑफ द रेमेडीज like all the medicine of burn, like cantharis, like causticum, like our muriatic acidica, all such thing, right?
Now, what is sebum? Sebum is liquid which is secreted by the sebaceous gland. And the sebum containing the fatty substance like triglyceride or cholesterol and linolenic.
Bacteria को ये बहुत पसंद है ना?
That's why the acne is.
Yeah, bacteria को ये triglyceride बहुत पसंद है, तो वो जाके चिपक जाते हैं, and that is why वो bacterial infection आता है, right?
Linolenic acid is also a type of fat which is polyunsaturated fatty acid, and it is also known as omega-6.
Yes, those are the food of bacteria. Bacteria वहाँ जाते हैं, उनको खाने को मिलता है और उसके बाद एक्ने होते हैं. खाने से एक्ने.
Now the second pathogenesis is increased sebum secretion. So sebaceous glands activity is mainly controlled by the androgen. Androgen are the sex hormone like testosterone, dihydrotestosterone, dihydroepiandrosterone, and others. So mainly the sebaceous glands activities are under their control. So when the sebaceous in the healthy person, sebaceous glands are normally working, the androgen comes and the sebaceous glands are sensitized and release the sebum. But in some people, the sebaceous glands become overactive. So sebaceous glands become very sensitive to the androgens. So the normal level of androgen, like testosterone, is normal in the person. The dihydrotestosterone is normal in the person. But these glands become very sensitive. So the normal amount of androgen comes here, and this sebaceous gland become excessively sensitive and release the secretion of sebum in a higher amount. That's why the sebum secretion is increased.
Yes.
Not due to the hormonal changes. Hormone remains same within the normal range.
आप रिपोर्ट करवाओगे, आप ब्लड रिपोर्ट करवाओगे, तो hormones are remain normal. Within normal limit में hormone हो, तो भी that can create acne. तो दैट डजंट मीन कि एक्ने वाले पेशेंट को आप एंड्रोजेनिक या कोई भी रिपोर्ट्स करवाओ। आपने एफएसएस करवा लिया, एलएच करवा लिया, टेस्टोस्टेरोन करवाया, इफ इट इज अंदर नॉर्मल, फिर भी एक्ने तो हो सकते हैं। द कॉज बिहाइंड दैट इज सेंसिटिविटी टू एंड्रोजन। तो डीएसटी एक्सप्लेन किया है,
नहीं किया है, मैंने निकाल
तो
दिया।
let me explain them. Testosterone is converting into DHT, dihydrotestosterone, with the help of 5-alpha reductase. This is also happening in the case of androgenic alopecia. This is also happens in cases of acne also. So the main culprit behind this situation is 5-alpha reductase. So you have to find out such remedy which works on 5-alpha reductase, or you can find such remedy which blocks this testosterone converts into dihydrotestosterone. If you can find any remedy which helps in this situation, that helps to reduce the acne. You are the new generation of homeopath. Guys, it is my humble request to do such research in your clinical practice. We are doing such thing nowadays. We are doing such things since very long in different cases, but this is the thing you can do at your clinic. Or do such clinical trial and you can find out such remedies. You can find out the remedy which reduces the secretion of testosterone. But if you find out such remedy, that also affects on some other part also. So you have to find out the remedy which works on 5-alpha reductase. And then only you can reduce this conversion of testosterone into dihydrotestosterone. Right? So androgen are very active in male compared to female. So adult acne are very common in male or compared to female. Female are very much conscious, तो उनको एक एक्ने हो जाता है तो भी वो दौड़ते दौड़ते आते हैं, लेकिन the ratio of acne is higher in male compared to female due to excessive secretion of androgen, or androgens are very active. That is why. Are you getting my point, guys?
Yes, sir.
Yes.
Are you with me?
Yes,
Yes,
sir.
sir.
Yeah.
Yes, sir.
Now the third mechanism is microbial colonization. Microbes like Propionibacterium, especially the Propionibacterium acne, Malassezia furfur, or Staph epidermidis.
This is guys new term for you, P acne. That is called as bacterial acne. You can write down in your case paper that is P acne if it is bacterial infection. How you can recognize it is bacterial infection? When you see the pus on the acne, when you see the whitish or blackish pus on acne, in those cases you can term it as a P acne in your case paper.
Now, the role of the microbes is that when the microbes colonize in the duct of sebaceous gland, that activate or trigger the inflammatory response, and then inflammatory response are active after that extracellular enzymes, inflammatory mediator, inflammatory cells are come at that region and producing the intense inflammation.
Yes. तो इन्फ्लामेशन होता है वहां पे, और इन्फ्लामेशन इज दी कल्प्रिट. आपको जितने भी रेड एक्ने दिख रहे, दैट इज द इन्फ्लामेशन. तो इन दोस केसेस यू कैन यूज आवर वंडरफुल रेमेडी फॉर टिपिकल इन्फ्लामेशन. कौन सी मेडिसिन है गाइस?
Belladonna. Belladonna.
Yes.
Mostly.
Another remedy?
Aconite.
Aconite. Then red tonsils. Red tonsils की कौन सी मेडिसिन? Inflamed red tonsils.
Apis.
Ruxtox.
Belladonna. Another.
Ruxtox.
Another is streptococci, guys. Streptococci and belladonna both have cherry red throat. That is the viral throat. So that redness के अंदर you can think of streptococci. we are frequently using streptococci medicine in such acne. That is inflammatory acne. Yeah.
Now the modifying factor, genetic predisposition. First is this. Genetic predisposition is generally not seen in acne, but familial history we see. If the parents having the acne in their adolescent age, so their child may get the acne.
पेरेंट्स आके बोलेंगे कि सर मुझे भी 18 साल के आसपास एक्ने होते थे, इसके फादर को भी होते थे और अभी मेरे बच्चे को है. That is genetical cause, that is hereditary cause.
Hereditary ज्यादा नहीं बोलेंगे सर, family ज्यादा बोलेंगे.
That is familial, not hereditary. Yes.
And patient with the cystic acne, if the parents having cystic acne, then definitely their kids get the cystic acne with the same severity in their pubertal age.
इवन एक सिस्टर आ रही है, मतलब एक फीमेल आ रही है, तो उसको सिस्टिक एक्ने है, तो उसकी सिस्टर को भी सिस्टिक एक्ने हो सकता है. That is, you can easily differentiate, you can easily diagnose for sister. या ब्रदर को हो रहा है तो सिस्टर को भी हो सकता है.
Now the diet, according to the dermatologist, the diet having the minimal role in the development of acne. But the diet like a high glycemic diet that causing the acne. High glycemic diet means those diet which we are ingested and broken down easily into the glucose in the body and increasing the glucose level very rapidly in the blood. That termed as the high glycemic diet. High glycemic diet like white rice, white bread, or the sugar.
Yes. See, diet ka as such there is no rule, but clinically we have seen many patients कि जो आते हैं और बोलते हैं कि भाई मैं ये खाता हूँ तो एक्ने बढ़ जाते हैं, मैं ये खाता हूँ तो एक्ने बढ़ जाते हैं. So in those cases you have to give dietary advice to the patient. According to Ayurveda, there are two things. One is sour thing and another is fermented thing. These are the culprits which increases the inflammation of the skin. So you can advise to the patient. See, each and every patient is different. Each and every patient's affection or triggering factor are different. But these are the common things according to Ayurveda. So you can advise to your patient कि fermented चीजें बंद करो या फिर खट्टा बंद करो. खट्टे में we can think of curd, we can think of buttermilk, we can think of नींबू ऊपर से डालना. So in those cases जब भी खट्टे की डिजायर होती है और खट्टे से एक्ने बढ़ते हैं तो कौन सी मेडिसिन देंगे?
Anti-Microbial crude.
Yes, we have one more remedy, that is antium crude. These are for khatti cheese, these are for sour, these are for pickles. And if it is causes, if it increases the acne, think of antium.
Now the cosmetic. Acne are frequently occur due to the use of the cosmetic products like oily based cosmetic product. Nowadays, the brands are labeling that these products are oil based or water based. So we can advise the patient that use the water based cosmetic product.
Yes, MAC के ये आप सब क्या cosmetic use कर सकते हो? There is mention. आप wife हो तो husband को खर्चा मत करवाना. It is quite expensive. So yes, you can use such products which do not contain this oil base.
And acne, after facial massage, we see the cases that the person developed the acne. So after applying the chemical, not the simple massage, but after applying the chemical substances like in salon or beauty parlor, and after that massage is given to the person, and then the acne is developed. Okay, now the menstrual cycle. There are lots of patients coming to our OPDs and saying the symptoms that before menses I aggravate or develop acne, and after subside of menstrual cycle, the acne disappear. So what exactly happened in the menstrual cycle? The pilosebaceous duct get swollen, edema of pilosebaceous gland. By that, the acne is appear. But after menstruation stop, the edema will disappear and the patient get the healthy skin.
What are the remedies we have acne before menses? Acne before menses is very common, guys. बहुत सारी फीमेल आएगी आपके पास who used to say you कि सर मेंसेस से पहले ही एक्ने बढ़ते हैं, मुझे एक्ने 4 दिन पहले बढ़ जाते हैं, I just get affected before my menses. एक तो पॉपअप हो ही जाता है, पूरा फेस भर जाता है. These are the term used by patients. What are the remedies? Acne before menses. Have you ever tried to such thing in repertory, guys? Anyone? Acne before menses.
Pulsatilla.
Okay. Or
Graphitis.
okay. Or
Sepia.
Sepia, miss.
okay. Sepia is there. Anyone?
Sorinum.
We have total 7 remedies in repertory. The leading 4 remedy I would like to share with you. Wait a minute. Yes. See, face, eruption, acne, menses before. We have leading 4 remedies. One is sepia, one is sorinum. See, this is sepia. This one is sorinum. One is magmure, and one is graphitis. Other are not specific remedies, they are rare remedies. So the 4 leading remedy: graphitis, magmure, sorinum, sepia. Whenever you get such modality, think of this remedy. Acne before menses, especially face ke upar, that is very common. In those cases, you can think of these 4 remedies. We are frequently using this remedy, and believe me, it works excellently, guys. Even some doctors are not using sepia frequently in teenage, but when I get such symptom, even leukorrhea in young female, guys, there is the leading remedy is sepia. I would like to share with you if I get it from the repertory. Female leukorrhea.
So mostly Natramure and that sepia is also there.
Can you say me the rubric? I'm not
Yes, sir.
saying right now. Female menses leukorrhea. School girl, young girl, ऐसा कुछ है?
Little girls mostly, sir.
हाँ, little girl, yes. नहीं, लेकिन वो भी नहीं है. Young में भी नहीं, yellow है. Girls में भी नहीं है. Sepia is there, but I would like to share other remedies also. Yes, girls in. That is only morning. Female leukorrhea morning, girls in. The single remedy is pulsatilla, but there is one another rubric which contains sepia. We are frequently using sepia in young girls. What's the rubric?
Female genital cells, leukorrhea, students in female.
Students. Okay, students में कौन सी है?
Single remedy, gel single.
Gel sepia. Okay, we are frequently using sepia. So guys, you can think of sepia. वो rubric मिलेगा तो
Children
Sir,
in
boric
girls
में
little में है
boric
sepia,
में
sir.
है little girls.
किसमें है?
बोरिक में occurrence है leukorrhea in infants and little girls.
Yes, यहाँ पे
Synthesis में भी है,
female
sir.
genital leukorrhea children, girls little.
Yes, sir.
2-3 mark remedy, that is sepia and moxol. Yes.
Sir.
Let me share you. Yes. Female genital leukorrhea children, girls little. So the sepia is 4 mark remedy, guys, and moxol is 3 mark remedy. Others are 2 marks remedy. So calcarea is there, mark IF is there, pulsatilla, yes, obvious. Medorinum is there, syphilinum is there, and yes, these are the leading remedies. So guys, in schoolgirl children, leukorrhea, think of these remedies. So this is about menstrual cycle. You can think of sepia, you can think of sorinum, you You can think of graphitis. You can think of magmure.
The psychological factor. There is no mechanism which explains the psychological factor causing the acne, but there are several cases that the person having the anger issues or possession anxiety and stress, that person having the severe acne.
Yes, after breakup, acne is very common. And yes, antium root definitely helps. Natramute definitely helps. These are the two remedy. These are the two leading remedy you can think of when there is acne after breakup. Believe me guys. बहुत सारी टीन एज फीमेल आती है कि सर मुझे कुछ नहीं हो रहा था, मुझे 2 महीने से ही एक्ने हुए और अभी 2 दिन पहले का ही केस है, लास्ट सैटरडे, 2 दिन भी नहीं, मतलब 3 दिन. We got a patient from USA. She came with mother, father, brother and भाभी, सब लोग को लेके आए थे. When हिमांशी took a case, हमारे वहाँ ऐसा है, पहले हिमांशी लेती है, वो अप्रूव करती है, उसके बाद पेशेंट हमारे पास आते हैं. तो हिमांशी took a case and patient denied to say anything as patient came as a reference. उसका भाई was my friend. तो she told us कि भाई breakup हुआ था, तो you don't disclose with anyone. तो फिर पूरे फैमिली को बाहर निकाला, उसको रुलाया. Yes, रुलाना is my hobby in clinic. पेशेंट को रिलीव करते हैं हम मेंटली, तो उसको रुलाया एंड देन वी प्रिस्क्राइब नेट्रम्यूर एंड एंटियम क्रूड, राइट. तो ब्रेकअप के बाद एक्ने इज वेरी कॉमन. सो गाइस यू कैन थिंक ऑफ दिस रेमेडी, मेंटल स्ट्रेस जिसकी वजह से एक्ने हो रहे हैं. तो दीज आर द रेमेडीज.
Now, epidemiology. Prevalence of acne is most common disorder which is seen. Almost all the adolescents experience the acne in their puberty age. Age-wise, we can see the 12 to 14 years here mentioned, but generally 10 to 20 years of male and female.
स्क्रीन शेयर नहीं, ओके.
Male and female experience the acne.
इवन बच्चों के अंदर भी एक्ने होते हैं गाइस. दैट इज कॉल्ड एज infantile acne. I would like to share a photo with you if I get from Google. Wait a minute. That is called as neonatal acne. बच्चे जो 1 साल के होते हैं, हाँ, neonatal acne. Let me share you photo. From the photo you can differentiate. That is always confused with atopic dermatitis, or that is always confused with eczema. Screen sharing. See guys, these are the photos of neonatal acne. बच्चे का बर्थ होता है और उसके बाद एक्ने ही हो जाता है. 6 months के बच्चे को एक्ने है, 4 month के बच्चे को एक्ने है. That is called as acne in babies or infantile or neonatal acne. That is self-limiting guys. वो self-limiting होता है. तो what is the cause behind that? Yeah.
3 years तक रहता है.
Yeah, that can be remain up to 3 years. Again, what is the cause behind that? बच्चे में तो एंड्रोजन सीक्रेट होते नहीं है, उसमें तो सेक्सुअल हार्मोन होते नहीं है. दैट केम फ्रॉम मदर. मदर के जो हार्मोनल चेंजेस होते हैं उसकी वजह से सच काइंड ऑफ एक्ने अकर्स. दैट इज कॉल्ड एज नियोनेटल एक्ने. और उसके लिए वी हैव वंडरफुल रेमेडीज. कौन सी मेडिसिन दे सकते हैं गाइस? एनी गेसेस? We have a wonderful remedy, that is viola tea. We are frequently using this remedy. What kind of eruptions are there? Think of viola tea in babies, especially atopic dermatitis or eczema. Even you can think of this remedy, viola tea. अपनी रस्टॉक्स, अपनी एपिस तो है ही, as there is redness, लेकिन along with that you can think of viola tea.
Now, the gender-wise, the acne vulgaris is equally affecting the both sexes. Generally, the nodulocystic acne are more prevalent, like 10 times more frequent in the male than females.
स्क्रीन शेयरिंग नहीं हो रही है, लेट मी शेयर स्क्रीन। यस, सो एज आई टोल्ड यू कि मेल के अंदर दैट हैपेंस अ लॉट, लेकिन फीमेल के अंदर दिखते हैं, एक एक्ने भी लोग के यहाँ कहा जाता है।